you have the end closest to the arterial here of a capillary, and then you have the venular end, the end that will feed into or become the vein. And so looking inside the capillary, we're going to look at each factor for inside and outside. So outside is the interstitial fluid, and we'll do this for both ends. So you'll get to practice and see it step by step. Okay, at the bottom, we have P, capital P. That's the hydrostatic pressure, and you need to state if that's for the capillary or the interstitial fluid. Next, we have our pi, which represents the colloid osmotic pressure, right? And we would say is that the colloid osmotic pressure due to the plasma, or is it the colloid osmotic pressure due to the interstitial fluid? Okay, so starting inside the capillary, the pressure, the hydrostatic pressure of the capillary is 37 millimeters of mercury, right? And that's the blood pushing against the capillary walls, trying to get out. Then this is the number that changes as you move away from the arterial, okay? All the other numbers are going to be the same throughout the system, okay? So pi of the plasma, colloid osmotic pressure due to the plasma is 25 millimeters mercury. This is always the same because those proteins cannot leave the capillary, right? Then you have your interstitial fluid that's in the tissue, and you're going to have some pressure, right? It does push against the capillary in the opposite direction, right? This is excuse me, I've been recording so many of these videos. Okay, this is very small. There's no pump pushing fluid through your interstitial fluid. It's kind of just loose throughout the tissue, right? So it's not being tightly contained and it's not being pumped, so the pressure is very low, right? So this number makes sense. And then you have your colloid osmotic pressure in the interstitial fluid. There's very few proteins there, so again, excuse me. So there's not going to be very much pressure then for water to move in that direction. In fact, it's so small that we call it 0, okay? And this is always going to be the same, whether you're talking about exchange at the arterial end or at the venular end, okay? And then your textbook gives us an equation to add all this up to figure out which direction and how much is moving in that direction. So on the equation, notice that it's going to be everything that wants to move out, all the pressures pushing out of the capillary and all the pressures pushing into the capillary. And we subtract those, and then that's going to tell us if you have a positive number, that's fluid leaving the capillary. If you end up with a negative number, then that's going to be fluid going back into the capillary, okay? So we have PC 37, right? Pi I 0. Okay, and then subtract hydrostatic pressure of the interstitial fluid is 1, and colloid osmotic pressure of the plasma, right? Because that water wants to go in, so it's in the opposite direction, so it's over here, and that's 25, and that's always 25. So what do you get? 37 minus 26 gives you 11 millimeters mercury wanting to go out, right? So it's a positive number, so you know that this is fluid leaving, going out of the capillary. Okay, and we call that filtration. Yeah. Okay, next, fluid exchange at the venular end. Okay, so you have your hydrostatic pressure of the blood in the capillary pushing against the capillary wall now is only 17. That makes sense. You just had fluid leave, right? Fluids leaving and leaving. And so as you get further away, you have less fluid, you have less pressure. You're also farther away from your arterial, so you're farther away from the pump, right? The heart. Okay, so for all these reasons, you have less pressure. It makes sense. I told you this number always stays the same, and as you can see, it did. This is also the same, and this is also the same. So using your equation again, you're going to plug everything in. So this time you're going to have only 17, and it's still plus 0, minus, this number's still the same, 26. So now this is more. So the pressures trying to go into the capillary are now bigger than the pressure trying to leave. So we get a -9, and this tells us that fluid's going to go from the interstitial fluid into the capillary. And we call that reabsorption. Okay, so regulation of blood volume. The kidneys are the organs that regulate our blood volume. It controls how much fluid do we let leave the blood and become urine, and how much do we hold on to. This also is going to be how much salt do we hold on to. So hormones are going to command the kidneys what to do. Antidiuretic hormone is going to tell the kidneys to hold on to water. So reabsorption of water in the kidney so that it does not go into the urine, but rather it goes back into the blood. So if you add water into the blood, your blood volume is going to increase. At the same time, your urine volume, the volume of your urine will decrease. Okay. Aldosterone is another hormone, and this tells the kidneys to reabsorb salt. Reabsorb salt. And water always follows salt. So if you put more salt into the blood, water is going to also follow it into the blood. So then your blood volume will increase. Next, Renin-Angiotensin system. This is another way to get aldosterone. So renin signals production of angiotensin II. Angiotensin II signals the release of aldosterone. Blood volume will increase. Okay, now, and let's go back. So I skipped over the reason because we just said it on the previous slide, but let's review. So if you get aldosterone released, that's going to, what is that going to do? That's going to tell the kidney to reabsorb salt. When you reabsorb salt, you're going to reabsorb water, and that's why your blood volume increases. Okay, and then next you have your atrial for it because it's being released by the atria of the heart. Okay, and then you have your natriuretic factor. Natriuretic, uretic, diuretic, diuretic. What's a diuretic do? Makes you urinate, right? So already now in the name you know where it's coming from and what it's doing. It's going to make you urinate. How is it doing that? It's doing that by telling your kidneys to go ahead and get rid of salt. So then your salt goes into the urine, and remember, water always follows salt. If the water follows the salt, then it's also going into the urine. If your water is going into the urine, it is leaving the blood. Therefore, your blood volume will decrease. All right. This is the 10-minute mark where I would normally stop, But I think everything's working now, so I'm just gonna finish out the lecture, a little longer video. Okay, so we talked about in the last lecture, chapter 13, circulation. In the left ventricle, your pressure goes all the way up to 120, right? Because you have to be able to open up your valve and push blood out. And then it's going to drop all the way to 0, okay, when it's refilling with blood. Okay, so you get this with each beat of the heart, you're going to get 120 and then 0, and then 120 and then 0, right? So you already know that part. Then if you were to measure the pressure in the left artery, so not in the heart, not in the ventricle, but now in the artery, you're only going to see a fluctuation from 120 to 80, 120 to 80. And that should sound familiar. 120 over 80 is a healthy, normal blood pressure. You put the blood pressure cuff on their upper arm using the brachial artery, right? And you get that 120 over 80 blood pressure. Okay, then as you move farther away from the heart, your blood pressure is going to decrease. You're going to have smaller and smaller vessels, right? Your smaller arteries and then your arterioles. So as you get into smaller and smaller vessel sizes, you are increasing resistance and your blood pressure is smaller and smaller. Okay. Then you enter your capillaries and you blood starts to leave, right? And you're in the smallest vessel possible. So your blood pressure is even lower and lower and continues to decrease, right? So you have more blood leaving than you have returning. And so you get that constant drop. Then you go into your veins and it goes even less and less pressure because now you're super far away from the heart. You don't have a pump for your veins. And then when you get back to the heart, it's at 0. So definitely take some time to study and understand this picture and the concepts that this picture represents. Okay. So blood flows from high pressure to low pressure. Everything flows from high pressure to low pressure. And as we just saw, pressure changes as you move through the circulatory system, right? So you start out with the highest pressure is right when blood's pumped out of the ventricle, and then the lowest pressure is right before blood enters the heart, right? Flow is going to be measured as a change in pressure, so your delta P or pressure gradient divided by resistance. Okay, so by having a lower pressure at the end of your circulatory system, it also helps to attract blood and help it flow through. Okay, so flow is measured by your pressure gradient, delta P, divided by R, resistance. And we'll actually look at this with more specifics in the next lecture. But for now, let's get the basics. So flow is a volume of blood over time. So volume of blood, right, milliliters per, it could be second, it could be minute, right, whatever unit of time you decide to use. Pressure is a force of fluid on the vessel wall. Resistance is going to be opposition to that flow. So the size of the vessel, the friction from blood on the vessel, right? All these, how far it has to travel, distance being far, right? All of those are going to contribute to resistance and oppose flow. So if your pressure increases, and pressure is coming from what? The pressure gradient, so how hard is the heart pushing, and what is the pressure at the end of the system? So yeah, if you increase this pressure, you're going to increase the flow. Good. And if you increase resistance, distance it has to travel, smaller vessels, right? All the factors that contribute to resistance, your flow will decrease. Okay, so practice question. Marion has been diagnosed with breast cancer and is about to receive surgical treatment. The doctor tells Marion that there will be removal of her right breast, right? That's called a mastectomy. Also going to have to remove some of the right axillary lymph nodes, lymph tissue. The doctor warns Marion that the side effect of this surgery can include a swollen right arm. Explain to Marion why it would be swollen. Okay, so pause the video and think about that for a minute. Okay, so I assume you did it. You thought it through. So removal of lymph nodes, it's going to remove some lymph vessels in that immediate area. So now you don't have the ability for the interstitial fluid to drain into those tissues. So it's going to take longer because they're going to have to go all the interstitial fluid is going to have to go through all the rest of the lymph that's still there or in the surrounding areas. So it's going to take longer for the lymph or the interstitial fluid, rather. It's going to take longer for the interstitial fluid to drain into the other lymph tissue, the lymph tissue that did not get removed. Okay, so this isn't always the case these days. We can usually isolate the particular lymph vessels that need to be removed, the lymph nodes, and so then you don't lose as much lymphatic tissue, and you might not have any swelling at all, or you'll have less swelling. But of course, if someone has a lot of cancer cells going on, they might have to still take more of it. But typically, this is not as big of a problem anymore. Okay, so good job. That's it. So all of these little videos, this is still just part 1 of chapter 14. So I will do part 2, hopefully in one video. And then also this week we need to go over chapter 15, immunity. Yay! And that'll be it for this week. Okay, hope you're doing good. Talk to me, email me, let me know what you need. Okay, bye.